If you've got neck pain, you've got a lot of options for providers to go see, but there is definitely one provider you should not go to first. If you happen to fall into this category of neck pain, then this video is definitely for you. Hello, I'm Dr. James Bogash, publisher of Modern Health Myths, as well as the owner of Life Care Chiropractic. As a chiropractor of 20 plus years, my opinion on this topic is obviously clearly biased, but it is also very strongly supported by the medical research out there. This particular study looked at opioid use and first provider seen. The title of the researchers looked at conservative therapists, so basically people who don't do surgery and drugs, but that category is generally reserved for thought of as chiropractors or physical therapists. That could also classify as massage therapists, but generally not. I'm very familiar with one of the largest insurance companies out there that deals with musculoskeletal pain because I was on a panel with them for several years and know what their numbers look like. But this particular study looked at opioid use depending upon first type of provider seen. Opioids are obviously a huge issue, and as a chiropractor, it's been frustrating that we talk about the back end of opioid use, like how to manage it, how to destigmatize it, but not how to stop it in the first place. And as a chiropractor, pretty much every study asking the question has shown that chiropractors as the first portal of entry lower opioid use, not only on the front end, but even up to 10 years later. Those patients who saw a chiropractor first were less likely to use opioids. There are certainly other reasons that people would use opioids that chiropractic can't help with, but it's the vast majority of reasons that people would seek opioid use for can be treated by a chiropractor. So in particular, this study looked at, a massive study over the course of 4 years, looked at about 428,000 people. So this is a huge study. And they found that there was a pretty big range, but that probably depends on provider type. But if a conservative therapist was seen first, those people were 72 to 90% less likely to use opioids in the first 30 days. It's a pretty big range, but still, that's pretty powerful. In other words, a huge chunk of these people never used opioids if they saw somebody conservative first. Stretching that out to a year, 41 to 87% of them had a lowered risk, or there was a 41 to 87% lowered risk of them using opioids, continuing to use opioids after a year. So this didn't just stop it in the front end, it stopped it for a very long period of time. On the flip side, if somebody went to the emergency room first, their risk of getting an opioid in the first 30 days was 358% higher than if they saw a conservative therapist first. I know for me, it's been better, but there was quite a few years there where somebody would go to urgent care or emergency room and get a prescription for an opioid for something that literally we had fixed in 10 minutes or drastically improved in 10 minutes. And they never needed to have that prescription, let alone the imaging and everything that was done at the wherever they happened to go. So again, as a chiropractor, my opinion is clearly biased. One of the advantages with chiropractors is that we are generally, we handle the cases completely within our office. So from the numbers that I remember from the large insurance company, something like 70% of patients who enter a chiropractic office never leave that chiropractic office for care of that episode. So if you went in for neck pain, you were highly likely to be managed in that case or in that office. That means that you have less cooks to spoil the meal, so to speak, not many cooks in the kitchen. And so when one person is managing care that knows how to manage care conservatively, the outcomes were going to be much better. If a PT was the first portal of entry, that they stayed in that office with single digits. I want to be it was 6 or 7%. So almost every time a patient entered a PT office as an initial point of care, they would end up somewhere else to coordinate care with. So again, the more EIN numbers you have, the more tax codes you have, the more complicated a case gets, and the less efficient and the less solid the outcomes are. So as I mentioned, my opinion is biased, being a chiropractor for 20 plus years, but it also is very heavily supported by the medical literature and my experiences with one of the largest healthcare companies, quite frankly, in the world. As always, make sure you like this video, share it with somebody who you think needs the message, and subscribe to the channel.